Hi everybody. In the last several videos we've been talking about Dr. Bredesen's ReCODE protocol for reversal of cognitive decline, which has been a crucial program for my dad. Dr. Bredesen's team has helped hundreds of people reverse their cognitive decline, establish mild cognitive impairment, and Alzheimer's disease with this protocol as evidenced in successful studies in 2014, 2018, 2022, and current clinical trials. In the last several episodes, we've come back to the cognoscopy. Dr. Bredesen's evaluation is screened for all the potential contributors and risk factors for cognitive decline. All of these tests and lab results paint a clear picture of where a patient stands and helps identify how they got there. It is the foundation for an individualized protocol to be built out for prevention or reversal. On the last episode, we specifically talked about the important inflammatory lab marker, hs-CRP. Next up, we're getting into another important lab marker called homocysteine. Okay, what is homocysteine? Homocysteine is a protein, an amino acid, that is present in small amounts in the blood. Well, it should be present in small amounts of the blood. Many times it can become elevated, and this is where the issues can begin. Because elevated homocysteine is extremely inflammatory, especially to our cardiovascular and circulatory system. As homocysteine levels build, this causes a lot of damage to our arteries and blood vessels along with other vital tissues. Elevated homocysteine levels that stay high for sustained periods of time, like years, which is not that uncommon, are associated with the onset of conditions like heart disease, atherosclerosis, the hardening of the arteries, heart attack, stroke, blood clots, Alzheimer's, other dementias and cognitive decline, neurological decline, hypothyroid, kidney disease, osteoporosis, and cancer. Elevated homocysteine is no joke, and Dr. Bredesen's team has seen elevated levels of homocysteine in many patients. High levels of homocysteine circulating in the bloodstream and getting up to the brain have shown to inflame the brain, damage its small blood vessels and capillaries, causing white matter lesions, inducing the production of amyloid and tau tangle proteins, and causing atrophy and shrinkage, especially in our brain's memory center, the hippocampus. Elevated homocysteine is no joke. So the key question now is, how does it become elevated in the first place? Well, to answer that question effectively, we have to look at homocysteine's key role in the body. See, this is a protein that's produced as part of a methylating chemical reaction inside of something called the methylation cycle. We'll be going deeper on the methylation cycle in future videos because it is so important, but the science of it all is a bit too much to cover in this video. All you need to know for now is that homocysteine is an intermediate step in the methylation cycle. And when the right conditions are met, homocysteine gets converted to other important molecules so the cycle can run optimally. Well, how important is the methylation cycle? The methylation cycle is responsible for the regulation of making and maintaining and repairing DNA and RNA, gene expression, neurotransmitters, hormones, cell membranes, proteins, immune function, energy production, and detoxification. You can see why we'd want our methylation cycle working well without any hiccups. Well, for this cycle to work optimally, homocysteine should not be building up. Once it starts doing so, all of these other vital processes the cycle is responsible for go into disrepair. So the body and brain is going into disrepair, dis-ease, illness, loss of function. Homocysteine building up is a sign that the right conditions are not being met, meaning we have some nutrient deficiencies that need to be corrected. In order for the methylation cycle to hum and run efficiently, it needs some key raw materials. We won't get into all of them, but the most important key nutrients are the B vitamins, vitamin B12, vitamin B6, and vitamin B9, also known as folate. Some other key nutrients the methylation cycle needs to run well are choline, magnesium, and zinc. Most often, these nutrients just aren't coming in through the diet at levels to satisfy the body's base minimum requirement for them. Many times, what high homocysteine levels are indicating is that we are deficient in vitamin B12 or B6 or folate or a combination of all of them. This is why Dr. Bredesen prioritizes a dialed-in dietary program that eliminates all the inflammatory empty calories and provides nutrient-rich raw materials our bodies and brains need to run optimally. Please check out episode 19 for Dr. Bredesen's anti-Alzheimer's diet. Also, To help bring homocysteine levels down, supplementing with the active versions of these B vitamins has worked really well for many patients. These active versions of the supplements that are readily usable by the methylation cycle are methyl B12, the active version of B12, P5P, or pyridoxal 5-phosphate, the active version of B6, and methylfolate, the active version of folate, B9. Dr. Bredesen's blood lab target range is for homocysteine to be at between 4 and 7 micromolar. Current standard of care views homocysteine between 5 and 15 to be normal. Yet, so many studies have shown heart attack and stroke risk as well as brain shrinkage risk dramatically rising once homocysteine levels climb above 7. Dr. Bredesen's team has seen cognitive decline reverse once levels have come under 7. Also, when's the last time a homocysteine blood lab was offered to you? Imagine if homocysteine was a standard lab test we all got with our yearly physicals, alongside the comprehensive metabolic panels, cholesterol, and all the other standard lab tests that we get run. Imagine how many heart attacks, strokes, and cases of dementia could be prevented because the disease process was caught 10, 11, 12, 13, 14, 15 years in advance, because the nutrient deficiencies were spotted and corrected all those years in advance. Recap. Keeping our homocysteine lab levels between 4 and 7 means we are getting the right levels of B vitamins into our bodies to help with the vital chemical processes, like the methylation cycle, run efficiently. This moves us closer to optimal health, wellness, function for body and brain. And on the flip side, homocysteine levels above that range starts moving us farther away from health and closer to disrepair, dis-ease, and illness. So we want to know where our levels are at and what our nutrient status is so we can take action on it. And I'd love to hear from you. Have you ever been offered to test homocysteine at your annual physical? What do you think of this video? Drop me a comment. If you found this information helpful, please feel free to share this video with anyone you think it could serve. And please like and subscribe as it helps our community grow. And remember, I'm not a doctor. I don't have a PhD. I'm a caregiver and citizen researcher on the ground, helping a loved one, someone just like you. This information is for educational purposes only. Please consult your medical practitioner before implementing any changes. Thank you for watching. My dad thanks you. Hope these resources are helpful to you and your family. And see you in the next video. Thanks.